Hi, this evening I'll be doing my assignment phase 3 therapeutic exercise protocol, which is going to reflect into my phase 3 and 4 of my protocol, so follow that one. My goals for phase 3 will be to continue to protect repair, reduce pain, minimize swelling, maintain full extension, and obtain flexion less than 20. Oh, I'm sorry, that's actually the wrong thing. Phase 3 will be to continue to protect repair, maintain full extension, normalize gait, flexion within 10 degrees of contralateral side, the non-injured, safely progress strengthening, promote proper movement patterns, avoid post-exercise pain and swelling. And then for phase 4, it'll be maintain full range of motion, safely progress strengthening, promote proper movement patterns, avoid post-exercise pain and swelling. So somewhat the same thing, it's just more of the progressions. So getting into our range of motion for phase 3, we will begin with our supine active hamstring stretch, which I'll instruct the patient, if their left leg is the one that's injured, I'll instruct them maintain their right leg straight on the table, straight in line, ankles, knee, hip, shoulders. And the same thing on the other side, the only difference is the patient's going to reach down with their legs and grab behind their leg, and they're going to try to keep this leg as straight as they can, and they're going to pull it back. The active part comes from by them lifting their own leg up and them trying to pull it towards them as well at the same time. All right, we're going to start this off. We're going to start with 2 by 15 seconds, progress up to 3 by 15 seconds or 3 by 20. Try to do that as necessary. All right, you can relax. All right, for this next exercise or next stretch, we'll be doing the gastroc stretch as well as the soleus stretch. So while my patient's laying down, I'm going to ask them to please stand up in front of the table. To do this stretch, it's going to be a difference in the isolation. You can face the wall over there so the camera can see. With your right leg being your injured one, you're going to bring it back behind you, keeping your knee straight. Okay, and then lean slightly forward. This is going to be the gastroc stretch. All right, from this position to go into the soleus stretch, or you can split them up. You're then going to bend your knee slightly, and now this is in the soleus stretch position. Patient can relax. It'll be 2 sets of 15 seconds to begin with, and then we'll progress up to 3 sets of 15 seconds, and we can progress the time even further to 20 seconds, 25 seconds, depending on the patient. All right, for this next exercise, we'll be doing the prone quad stretch. So the patient's gonna lay prone in this position. We're gonna use our handy dandy stretching strap. I'm going to ask the patient to flex their knee. I'm going to put this strap around here, and these are all things the patient can do themselves too. They're gonna reach over their shoulder. They're gonna hold the stretching strap. They're going to pull on the stretching strap so it pulls the muscles around the knee and into the quad. And this is going to be held for the desired amount of time, 2 sets by 15 seconds to start off with. We can increase this to 3 or 4 sets by 15 or 20 or 25 seconds. To make this a little bit more challenging, we get a little bolster. We can lift the knee off the table, put the bolster underneath it. It'll stretch the leg a little bit more. All right, patient can relax. Next one we're going to be doing is the standing quad stretch. So I'm going to ask my patient to come stand out in front, please. To do such, the patient's going to face that way for the camera view. The patient is going to actively flex the knee and hold their foot in the back of their hand, and they're going to pull their heel to their bum while bringing their leg back while maintaining an upper torso straight and perpendicular to the ground. All right, patient can relax. Again, 2 by 15 seconds, maybe 3 by 25 seconds to progress, or even up to 4 sets. The next one is going to be the kneeling hip flexor stretch. So I'm going to ask the patient to enter a kneeling position. They can use something for comfort. Their front leg, so they're going to stand in this lunge-like position. Their front leg's in front bent at a 90. They're going to reach back and grab their right leg just like we did the quad stretch. So we're going to stretch the quad, but we're also going to sink the hips forward, stretching that hip flexor region. All right, this patient can relax. That's going to be 3 sets by 15, or 2 sets by 15 seconds, increasing up to 4 sets by 20 or 25 seconds. Cardio section will be stationary bike. You can refer to my phase 2 video. The only difference is we might add a little bit more resistance on the bike as tolerable, decrease if it's not tolerable. The idea is to have them be doing this for about 15 to 30 minutes and progressing up to that 30 hopefully. The other exercises will be swimming related. We don't have a swimming pool. So the exercises are going to be flutter kick swimming. That can either be holding onto the wall doing the flutter kick, or you can be holding the kickboard and doing laps back and forth. The only thing to be mindful of is that we don't want the patient pushing off the wall or pushing off the ground, doing that sort of compressive force that would further damage the meniscal repair site. The other thing is going to be pull jogging, so they'll be doing the running motion with their knees coming up to their chest, just as we did in the HCA lab. The thing to note with this is, again, we're not touching the floor or anything of that. We walk the patient through a series of squat exercises. There's several. First one is going to be partial squat exercise. This chair is a little bit lower than ideal, which we want them to be going from that 0 to 60 degrees. So ideally this chair would be a little bit higher. We're a little resource limited at this time. So to do such, the patient will be feet shoulder width apart, the hands will be out in front in like a cup to like position like this. The patient is then going to do a regular squat down to the chair to that 0 to 60 degrees, and the patient is going to rise back up. All right, that is again the partial squat exercise. We're now going to remove the chair. We're going to do ball squats. So we place the physio ball or Swiss ball behind them on the small of their back. They're going to, again, feet shoulder width apart. The idea of this is that they're not putting pressure and pushing back into the wall, but they're just pinching the ball between their back and the wall. So now they're going to go down. They're going to do a normal squat just as we did with the chair into that 0 to 60 degree range. So come down, stop just before 90, and come back up. All right. We can remove the ball. And we can start off with wall squats. So the patient's going to lean against the wall. Again, we're not trying to push the wall over, but purely just trying to put some force behind the wall and his back. And he's going to squat down to about a 60 degree, come back up. All right, and this is good because his back's straight, his knees are bent as such as necessary. All right, the patient come forward a little bit off the wall. The next thing is going to be the mini squats. So we're doing everything we just did. However, we're not going to put our back against the wall. They're going to be feet shoulder width apart, hands are going to be out in front. And they're going to do a squat, maintaining a straight right back to perpendicular to the ground, 60 degrees, and come back up. All right, we're first going to start off with about 2 sets of 8. We're going to progress up to 3 sets of 10, maybe 4 sets of 10, depending on how this patient is doing. The idea is to go from the partial squat with the chair to the ball squat, wall slides, and mini squat kind of being the final one in this exercise. One of the first strengthening things, or one of the additional strengthening things we'll be doing, is a prone hamstring curl. Patient will lay prone. We're going to do these with no weight to start off with. Their right leg's the one that we're working on. Patients can maintain a straight line from the shoulders to the hips to the knee, and they're going to flex their hamstring and bring their heel up to their bone. So go for that as far as you can go, and then come down. All right, this patient can relax. To progress this, we're going to first start off with 2 sets of 8. And then to progress, we'll go up to like 3 sets of 10. We can also use the cuff weights. We'll start off with low weight of a pound, pound and a half, and hopefully get up to about 5 pounds by the end of this. So that would be the prone physio ball bridges. So to begin with, we'll just be doing a regular physio ball bridge. So to do this, the patient can be in the supine position. I'm going to place the ball here, and they're going to place their feet on it with their knees straight. The patient can stabilize with their hands down by their side if they wish to, more to prevent the ball from rolling off. The first one is going to be the bridge, and just the basic bridge on the physio ball. So to do this, I'm first going to tell the patient, please set your abdomen region, and that's going to be consistent through all of them. So if I don't re-hit that every time, I'm telling the patient now. Set your abdomen, you're going to bring your belly button to the back. You're then going to bring your hips up off the table into a straight line position, and you're going to hold this, and you can relax. First, we're going to start this off with, we'll do 2 sets of 6, 2 sets of 8 with about a 3-second hold at the peak, and hopefully progress this up to 3 or 4 by 10 with about a 5-second hold. Or we could also do this for endurance for the length of hold. We'd first have to get like a 1 rep max kind of thing and go from there. All right, the next one will be the glute bridge with ball rolling. So to do that, the patient is first and simultaneously going to raise their hips as well as bend their knees and bring the ball in, and then raise their hips a little bit higher. All right, and then bring it back out. They can drop down and come back up like this. And relax. All right, and the last one will be bridging with alternating touches. So what we're gonna do is go back to kind of the first one. The patient can bring their hips up off the table. They're then going to bring their left leg off the ball, down, right leg off the ball, down, and alternate back and forth. And relax. And you drop down. Start off, we're gonna do about 2 sets of 10. That way we get 5 touches on each side. Or we can even do 2 sets of 6 and left, right be 1 rep. And hopefully progress that up to 3 sets of 12, 3 sets of 15 kind of thing. All right, for this next set, we'll be doing the hip hikes. So I'm gonna ask the patient to step up on a block such as this. We're then going to near one side. We're going to do this on the patient's right side. Their right leg is going to drop down. So, stand back up. Your legs stay straight this whole time. You're going to drop your right leg off, and you're going to drop your hips down, and you're going to bring your hip up. Hip down, hip up. And you're not really bending your left leg at all. That should be straight for the most part. So it's more of a tilt in the hips. Yep. Down. Oh, sorry. Down. Up. All right, so clearly we're going to have to work with this patient. Let's try it again.
Patient's balance.
Down. Yep. There you go. Now you got it. So we're going to start off with 2 sets of 8, and then we'll progress up to 3 sets of 10. So there's also a series of gym equipment exercises that we don't have quite necessarily in a clinic. These exercises, the patient will be advised to use the equipment in their gym, whether that be like Longwood Rec Center or Tiger Rec or some other sort of gym that they have the accessible equipment. These equipment includes leg press machine, hip adductors and adductors, hip extension machine, Roman chair, and seated calf machine. There is included hot links on all these therapeutic exercises to include the machine exercises in the Massachusetts General Protocol. I would advise the patient to follow those, as well as look at the instructions on the cable machine or whatnot. And then worst case, they could also ask the representative from the gym how to use it. And then even further, they could contact me and I could then go to them with the gym if I have access to it. But videos and instructions are included in the Mass General. Next thing is going to be a balance exercise. It's going to be single leg balance. First, we'll start on an even surface and progress to an uneven surface using an RX pad. So I'm going to ask the patient to stand with their hands out the pocket, feet shoulder width apart. They're going to raise their right leg or the left leg in front to a 90 degree position, trying to balance the best they can, and relax. All right, this patient's going to do it. We're first going to start off. We're going to start real simple, probably 2 sets by 10 seconds, 2 sets by 15 seconds, get it up to 3 by 20, 3 by 25, and then we're going to progress over to an RX pad. So we have this here for them. Patient's going to take their shoes off if they deem necessary. They're going to stand bilateral, feet on the pad, and then they're going to do the same thing, 99 degree, hold it, and they're going to balance in this position for the necessary time. Again, we probably start them off about 2 by 10 seconds. You can relax. We progress up to 3 by 15, 3 by 20. So that's my phase 3 exercises. The criteria progressing mean no swelling or pain after exercise, normal gait, range of motion equal to contralateral side, and joint position sense symmetrical within 5 degrees margin of error. Going on to my phase 4, we already talked about some of the goals. To start off, the cardio is going to be an elliptical machine and stair climber machine. We don't have those in the clinic. Again, we'll advise the patient go to the gym, utilize that equipment. They can use the instructions on the equipment and ask the person at the front. Worst case, I'll go down, as well as it's in the Mass General rehab. It was lateral lunges, so I'm going to ask the patient to stand about shoulder width apart, semi-athletic stance. I'm going to ask the patient to do a lunge, but instead of going forward, they're going to bring their right leg and go out, bend their right leg, left leg stays straight, come down to that position, come back up, bring your feet back together, shoulder width apart. You're going to continue doing this. That would be 1. This would be number 2. We're going to start off with 2 sets of 8, progress up to 3 sets of 10, maybe 3 sets of 15. The next thing, which we don't have the equipment currently, is going to be a slide board lunge. The patient is going to conduct that lateral lunge the same way they did on the ground. However, they're going to put the foot booty around their right leg, and then they're going to lunge out onto the slide board, and this time their right leg will be the one that is straight, their left leg will be the one that's bent, and they'll come back up. Next thing we'll be doing is a single leg squat, synonymous with the term pistol squat. Left leg comes out in front, hands are cupped in front. We're then going to go down to that 60 to 90 degree, come back up. This patient will relax. What we're focused on is a perpendicular torso. We're not lateral bending to compensate, and we're trying to do some one fluid motion. It's a little bit trickier. Start off 2 sets of 6, progress up to 3 sets. Precursor to the single leg squat, which we demonstrated, is also going to be a single leg wall slide. Going back to our phase 3, the patient's back is going to be against the wall. The left leg's going to come out in front. You're going to squat down with their right leg, coming to that ideal 60 to 90 degree range and slide back up. It's a little bit easier because they do have the support of the wall. We're trying to maintain it perpendicular back to the ground. We're trying to maintain a good overall posture. We're not dipping laterally. We're not trying to compensate otherwise. We're going to start off 2 sets of 6, a little bit trickier, and then we get up to 3 sets of 10. Next exercise we're doing is a Romanian deadlift. To make this exercise a little bit more muscle memory to the patient, we do have a dowel rod. We could progress this up to an actual dumbbell or weights or kettlebells or something if we desire later to progress. First, we'll start with 2 sets of 6, progression, get up into later about 3 sets of 10 with some weight possibly. Before we're just gonna do body weight, maybe dowel weight, if that's a thing. All right, so to start, the patient's gonna go down, the dowel's gonna be on the floor, a slight bend in their knee, not a whole lot, and then they're going to stand up with their back, straighten their knees, stand up straight, and that's one set, or one rep. They're gonna do that like we mentioned earlier. Things to be mindful of: we don't want any valgus force in the knees, we don't want any compensation. We want this to be a slow, fluid movement.